Hi, this is Dr. Sridhar Vennamaneni from Prathima Medical Center. Today we'll be talking about high blood pressure. As you're all aware, blood pressure is one of the primary risk factors for heart disease and strokes. And in India, 1 in 4 person has elevated blood pressure, and almost 50% of these patients do not have any idea that they have high blood pressure. What is blood pressure? When the heart pumps blood through the arteries, the blood creates pressure on the walls of the arteries, and that pressure is what blood pressure is. Normal blood pressure is less than 120/80. And when we talk about systolic and diastolic blood pressures, systolic pressure is the blood pressure inside the arteries when the heart is contracting. And when the heart relaxes, the pressure inside the arteries is the diastolic blood pressure. In general, if you look at the risk factors for elevated blood pressure, the most common cause of elevated blood pressure is being obese and overweight and leading a sedentary life. The other risk factors for high blood pressure include aging. As we age, the blood vessels get much narrower, and that in turn can increase the blood pressure. The other risk factors include excessive alcohol intake, smoking, family history of elevated blood pressure, sleep apnea, and then other endocrine causes, which include elevated thyroid hormones or elevated adrenal hormones. And there are some extreme other rare causes of elevated blood pressure, including blockages in the renal arteries. In terms of symptoms, most patients with elevated blood pressure are asymptomatic. So blood pressure is labeled as a silent killer because of that reason. 90% of patients don't have any symptoms unless the blood pressure is extremely elevated. When the blood pressure is extremely elevated, patients can have headaches, dizziness, blurred vision, they can pass out, they can have vomiting, sometimes they can have seizures. And that can be an emergency. So it's very important that everybody get tested for elevated blood pressure. The complications of untreated blood pressure include plaque buildup inside the blood vessels is one of the main things. Heart disease is the #1 killer all over the world, including India. And elevated blood pressure is one of the common risk factors, along with diabetes and elevated cholesterol. So when somebody has elevated blood pressure, also the long-standing blood pressure causes thickening of the heart muscle, which in turn can lead to heart failure. The other complications of elevated blood pressure include stroke and dementia. There are numerous studies that show that patients with uncontrolled blood pressure have worsening memory with time, and that in turn leads to what's called vascular dementia. Elevated blood pressure otherwise also can cause, very commonly, kidney disease leading to dialysis, can cause bleeding in the eyes, and a bunch of other vascular abnormalities, including aneurysms and poor circulation. The treatment for elevated blood pressure includes medications, and then we have non-medical interventions. What are the non-medical interventions? The main interventions include diet and exercise. In terms of diet, the recommendations are to limit the amount of salt intake to less than 1 teaspoon a day. 1 teaspoon equals about approximately 2,300 milligrams of salt. And so the recommendations are to reduce it to about half to 1/3 of a teaspoon. In addition, increasing consumption of more vegetables and fruits and limiting fatty foods and fast foods and reducing meat intake is extremely important. The other recommendations to bring blood pressure down would be to exercise at least 30 to 45 minutes every day. So that comes to approximately 150 minutes per week minimum of brisk walking, jogging, treadmill, or any other kind of exercise, including dancing. In terms of pregnancy, elevated blood pressure can be extremely serious to pregnant moms and the babies also. Untreated blood pressure in pregnancy can lead to liver and kidney problems, seizures, strokes, and also can be fatal if untreated. For the newborn child, elevated blood pressure can lead to preterm deliveries and low birth weights. So for that reason, all pregnant women should be closely monitored for elevated blood pressure. Blood pressure can also be a problem for children and teenagers, and so it's very important that parents limit the intake of fast foods and foods with too much fat, and increase the consumption of fruits and vegetables. There are a lot of questions about intake of coffee and other foods for elevated blood pressure. Studies show that most people, if you are consuming 3 to 4 cups of coffee a day, and you've been doing that for quite some time, blood pressure will not be affected. But if a person's start increasing the coffee consumption, or if they have a lot of stress, or if they're increasing their fast food intake or pickle intake, those are all factors that can lead to elevated blood pressure. There are different kinds of treatments for blood pressure, and at this point, the current guidelines are, our goal is to keep blood pressure less than 130/80. Studies show that in patients with elevated blood pressure, if the blood pressure is more than 120/80, 10 points above 120/80, the risk of stroke and heart attack doubles. So our goal is to keep the blood pressure less than 130/80 for most patients, irrespective of age. Unless the patients are very frail, where we feel that the side effects of the medications outweigh any benefits, for those patients, we can be more flexible with the blood pressure goals. But for most patients, the goal is to keep blood pressure less than 130/80. And so it's strongly recommended that patients stick to their regimen of blood pressure medications and avoid stopping the medications once the BP is under goal. Thank you.